to see what I can find in that. And an example of how I'd study, look at your case would be, we all drive on the freeway. You're at rush hour. Somebody comes and cuts you off. Okay. Right in front of you. And there's a few things we can do. We can do some hand images. We can say a few choice words. We can speed around them and cut them off. We could tailgate. We could drive by them and probably show them a gun, which wouldn't be too cool. No. And we probably even could have a gun, which is even less cool. Or we could sit there and go, thanks, good job, Kim. You were paying attention. You didn't get in a car accident. Now, all of those are legitimate ways to respond. Some of them would give us more discomfort than others,
right,
and more consequences than others. And my job as a homeopath is to understand your response and to understand where that gives you discomfort and dis-ease in a sense.
Okay, yeah, because we all are such individuals, and that's so great that you would look at us as one individual on top of another. And even though my mother is my same DNA, you would look at her differently because of her eating habits and the variables, and even probably her sleep pattern. Yeah, so that's good, good. Okay, so then if I did come to you with some symptoms, then would I come every week? Would I come once a month? Or how long would I see you?
Well, usually I'll study your case, and that takes a bit because I am trying to find patterns and figure out which of the 10,000 remedies fit. Give you the remedy. The remedies are deep and gentle healing, so sometimes they take longer. If you're younger, I've seen them work in a second, like an infant. They work right away. But we're older and we've been through more life, so sometimes it's a slower go. But I'd see you again in 2 months to see how you were doing. And depending how the remedies worked, and depending which kind of remedy I would give you, I'd see you maybe once a month.
Okay.
But usually every couple of months. And it's roughly about a month of homeopathy for every year you've had your symptom.
Oh, okay. Yeah.
It's not a quick fix, which, again, in our culture, we sometimes want quick fixes.
Yeah. I mean, we've worked this body so hard that all of a sudden we are all down and we go to the doctor because we are so sick. And we've pushed the body and pushed it and pushed it and pushed it. And then we want to be ready in 3 days.
Yeah.
Yeah. We want to be perfect, whereas we probably have progressed this for the last 5-10 years.
Or maybe a lifetime of things.
Yeah, that's true too.
It might be.
Yeah, good point. How do you know exactly what to give me then?
Well, that's the fun part, because I need to understand your response. So the car example I gave, are you the one that responds with anger? Are you the one that responds with attack? Is that how your body responds with, say, indigestion? I mean, how do you feel about when it happens? So I take all of those things together, and that's the part where I study it, and then I look at all the provings and all the remedies, and then I get a list. Luckily, there's computer programs that help me sort through the 10,000.
Sure.
But they don't give me the brain to pick out which one.
Oh.
It's like ask the right question, you might get the right answer. And then I see which one fits the best with all of the things that you've told me. And, quote, taking your case, that's the lingo that we use in homeopathy.
Give me the remedy.
Yes, and then it will work and help you return.
Yeah. And help my body help itself. Yeah.
Because our body wants to be healthy. You think about it, it does the best. If we could live as well as our bodies live with what we give them on the earth, we wouldn't have pollution, global warming.
Yeah.
When you think you can be up for 36 hours, your body will keep going. You could feed it Coke and chips forever, and you can keep going for a while. Eventually not, but you can actually, your body does quite well, and you can function.
Yeah.
Not forever, but, I mean, it does really well.
Yeah. And the saying, or I love the saying, when you put good in, good comes out. And so that's really important.
It is.
Yeah. And so you would actually help me put good in.
Yeah. Yeah. The remedy that I choose is your same symptoms, because it's like treats like. So, but it's not what got you there.
Right.
So your vital force goes, aha, something's not quite right, and I think it then reacts to that and then rebalances so that you're in a better state of health. That's my understanding, best as I can explain it.
Yeah.
Otherwise, it's magic. And I don't know, it works too consistently to be called exactly magic, but
Sure.
some of the things that it does is pretty amazing.
Yeah. And that's why this is so great to, with how amazing it is, to bring forth this to the viewers so that they have a better understanding of it too. Yeah. So perfect. And let's say, for instance, I'm on other medications and or a medication that you have given me, you know, as a homeopath. And what will happen if I have to take another medicine? Will it conflict with it or interfere at all?
Well, good question. You know, my hope is always that people eventually won't need either a prescription medication, or in homeopathy we call them remedies. But what often happens is, as you're on the remedy, you need less of your prescription medication. Now, I don't adjust that dose. I say go to your doctor and say, you know, now my blood pressure is like too low. Could I lower my blood pressure medicine, and then arrange it there, because it needs to be followed.
Right. And so,
Yeah, so eventually you cannot need them.
wow.
Yeah, that's the goal.
Yeah, exactly.
And not need me too, which probably puts me out of a job, but it's okay.
Yeah.
You're healthy, I don't care.
Yeah. But that almost reassures a lot of people too, to know that you're not just in it for the money, that you're actually in it to make them better and to give them their quality of life that they came to you for.
Well, to help them get it, yes. 'Cause
exactly.
You still have to do all the work if you're the patient.
Yeah.
I have to do a little, but I make suggestions.
But even to know that you're not in it just for that one goal. You're actually in it to help me help myself.
Right.
Yeah. So that's good.
Get better.
Yes. Yeah. And for my family, my loved ones, myself, you know, the quality of life is so important.
It is.
Yeah. It's so good. You have a degree as a medical doctor, and you also have a degree as a homeopathic doctor. And so when they make that decision, should they come then directly to you or go and see a medical doctor for their blood pressure?
In homeopathy, in my private practice, I'm doing homeopathy at this point. And I only combine the two in that I have the knowledge of the two.
Okay.
So I have the knowledge of the prescriptions, the blood tests, and all of that. But I wouldn't, I don't do any of that in my private practice at this point. I do hope to combine the two in a practice that might include that.
Yes.
But right now, you probably still need your primary care doc, because there are a few things that a homeopath can do. We cannot put a cast on your arm.
Right.
I can actually as an allopath, but not in my private practice. But you need the cast and the splint. We can't take out your appendix, but we actually have some remedies that can help the appendix be less. My teacher in the at Northwestern Academy of Homeopathy actually had a patient who went in, and by the time they got there, the appendix healed by the time they got the ER, but we can't do surgery. I mean, there are times when you need things done that the medical doctor can do, and there's times a homeopath is an excellent choice.
Right.
So my combination allows me to cross those two divides, but I'm not doing the medical part in my private practice right now.
Okay. Yeah. But that's great that someone can come to you and consult with you on, you know, where you think they should go, you know, in regards to that. And also, you know, in regards to, of course, a heart attack.
Yes.
And you have to go to a regular doctor on that.
Well, maybe if you're having one, go to the emergency room.
Yes.
Chew an aspirin, go to the emergency room right now.
Exactly. Dial 911 for sure.
Yep,
Yeah.
yep.
That's good. So can you tell our viewers maybe an example of how homeopathy works, or it's helped someone who's actually been seen by a regular doctor?
Yes. You know, I can think of, I have some other examples, but let me think of one I'm not using. I can think of my daughter slamming her finger in the car door.
Okay.
So this is an acute treatment, so right away emergency. And you know how your finger swells up and it gets all bruised and it's going to be a week and you can't use it and it hurts. And with homeopathy, we gave her some arnica, which are little pellets. I brought some actually.
Okay.
They're wee little things.
Oh my gosh, they are.
Yep, and you just,
Could I
the
open
kids
this?
love them. Yep, but here, let me.
Yes,
I always put this
please.
on so it doesn't open up in a pocket.
Okay.
But they're very little. They're little pellets.